set up, I just want to ask the third presenter, are you a swimmer? Because we've got cycling, running. If we had swimming, we could be a 90-year-old triathlon team. No? No? Okay. If you change your mind, let us know. So Sandy, unfortunately, isn't able to be here, and so not only is she not here, but it's actually my presentation. So I'll just ask you to bear with me. I'm not a clinical person. I'm going to give you a little bit of an overview of a number of things that we do at Hotel Dieu Hospital, and a little bit of an overview of a few of our programs that really do support seniors in particular in our community, and I'm going to zip through it fairly quickly. So just a bit about us. We are the Ambulatory Care Teaching and Research Centre for Southeast. So that really means that all of our patients, with the exception of a couple, would come in for a specialty visit and go home the same day. And the exceptions are that we have a day surgery program where some patients would stay overnight if they need to have special monitoring or extra pain control and go home the next day. The other exception is that we are the only hospital in Ontario doing short stay hip and knee replacement surgery. So for many patients, they can come and have a hip or knee replacement at Hotel Dieu Hospital. They have a lot of preparation in advance of their surgery. We get them up and moving around the day of their surgery, and they're actually home with intensive support within 48 hours. And so those are the exceptions. Everyone else comes in and goes home the same day when they come to Hotel Dieu. So I'm going to just talk about a few things. I'll really quickly tell you a little bit about patient and family-centered care and some initiatives happening at Hotel Dieu, cover a bit of safety, talk a little bit about a couple of programs, and then a few general comments. So under our strategy, we have really focused on a particular direction around excellent experience, excellent care. And as part of that, we are implementing a model of patient and family-centered care, and we're using the 4 core principles that are articulated by the Institute for Patient and Family-Centered Care. And this is something that's happening at lots of hospitals around Ontario and Canada and North America, including our partner hospitals here in Kingston. So really, it's just a real focus on planning, delivery, and evaluation of healthcare that's grounded in partnership. And that's a different kind of way of thinking about patients and families. So we're really trying to shift our focus to think about patients and families as partners. So not doing things to patients and families, but rather with patients and families. So the 4 core principles of patient and family-centered care are dignity and respect, so really listening to patients and families and respecting the perspective that they bring, the values, the cultural backgrounds. Information sharing, so that's not just sharing information when a patient comes for their visit, but how do we actually help someone before they arrive? Do we give them good information about how to find our hospital, where to park? For lots of our patients coming from the region, they don't know Kingston, and Kingston's confusing with lots of one-way streets. So we're really giving some thought to information before, during, and after their visits. We're really trying to focus on encouraging participation in care. So at all levels of care, we want our patients and families to participate at the level they choose. And that's a really important statement, because some people will want to be very, very involved and others will not, and that's okay. And so we just need to be respectful of the place that people arrive at when they come for care. And then collaboration, so really looking at patients and families and involving them in every aspect of what we do in the hospital, from planning services to evaluating services and everything in between. So a nice little way of thinking about what that means in a nutshell is to use the phrase, nothing about me without me. So it's that notion of participatory care. So one of the things that's really important is that we know that the people who rely most on hospitals are also the people who need others in their life the most. And so those tend to be children, seniors, and people with chronic conditions. And that pretty much describes most of our patient population. And I know we have some nurses in the room here, and I'm sure that you've seen that in your own practice. And so we really want our patients to have an opportunity to define what family means for themselves. And for many people, particularly the elderly, they may not have blood family living right near them. And so it's not uncommon for us to have seniors who come with a neighbor who's a good friend, that might be family to them in their care context. And so it's really about being respectful that a patient can choose what family means for them. So just a little bit about where we are. This is a sort of a new journey for us, and we're early in the days. So we have actually added our core concepts of dignity and respect, information sharing, participation and collaboration to our orientation for all new staff at the hospital. And we're really working on rolling out a model. So we recently developed a workshop. We had some funding through the Registered Nurses Association of Ontario that allowed us to backfill every nurse in the hospital so that each nurse could come to a 4-hour education session. And it's really hard to get our busy nurses there without being able to replace them. So that was really important. And we had about 250 staff members who went through a 4-hour workshop about patient and family-centered care. And I'll tell you, they're doing this now. We have great people and great staff, and it's really about making sure that in every part of the hospital, we're really living the principles consistently every single time. So we've got great people, and we just want to make sure that we're always doing this every day, every time. We've also met with our counterparts at Kingston General, and they are a little further along this journey and have just a terrific group of people who are working with them on patient and family-centered care, and had the privilege of learning a little bit from them about their journey as well. We've looked at what other hospitals are doing. So what difference does this make to patients to implement a model? Well, it's really about having the voice and the input of patients in every aspect of what we do. And so it's not just about them coming for care, but really influencing decisions that we make as an organization, what's important to patients and families. So we've talked to other hospitals, and we were lucky to have a Queen's student who did a little project for us. We have a group of physician champions that are really helping to make sure that we are looking at embracing a model through the entire organization, not just with our nursing colleagues, but with all of the different professionals. We've done some initial research. We've started to recruit patients, and that's the most exciting part for me, is we've got 2 patients recruited to work with us, and they have helped us to develop a bit of a role description for what patient and family experience advisors will do at Hotel Dieu Hospital. So we're early in the days of starting to recruit some patients and families, and to create a council and to roll education out to all of the other people who work at the hospital, so that whether it's a housekeeper, someone who works in finance, someone who works in the urgent care center, that we are all making sure that in every interaction we really are providing an excellent experience and excellent care. So that's a really sort of fast overview of that. So again, just really thinking about patients and families as partners. And we know that this is really linked to quality and safety. So as a specific example, if you're a patient who comes in to our hospital and the nurse or the physician or whoever's providing care asks about your medication history, and you have a little bit of dementia, you might not be in a position to remember all of the medication, and that's really important for safe care. Having a family member with you to help with that can really mean the difference between safe care that's provided because the patient and family are providing that information, and a medication error. So it's really linked to quality and safety, and that's why it's relevant to this discussion. So we're really excited about this. So I'm going to talk, excuse me, briefly about 2 of our safety initiatives at Hotel Dieu Hospital: falls prevention and medication reconciliation. So falls can be fairly serious, and particularly for some of our elderly patients who come in. As I mentioned, most of our patients come in and they go home the same day, but we do really stress that falls prevention is a safety priority for us. So with every single fall that happens on our property, we record that into an online safe reporting system so that we can actually investigate what happened. Was it that a carpet wasn't secured properly? Did we have water on the floor? Did someone who needed a wheelchair have a problem finding a wheelchair and ended up having a fall because of that? So we really want to know what happened so that we can really strategize what to do differently to improve the situation for the next person who comes in. So we look at environmental factors. Is there anything that we can do to reduce risks? And that might be putting up a special railing or having more wheelchairs available. And it might be really strategizing around particular groups that we know are at higher risk for falls. And those tend to be people over the age of 65 and our eye patients. So we have a very large eye clinic, which I'm going to talk about shortly, and lots of our patients either have no vision, low vision, or their vision might be okay, but they've just had their pupils dilated, so they're not seeing particularly well. So those are areas where we're really focused on making sure that we prevent any falls. So just as a statistic, we had 37 falls in 2011-12. As I mentioned, we track and investigate each one. It's a small number, but we really focus on getting that number as low as we can. The second piece is medication reconciliation. And we know that our elderly population are often given multiple medications and often from different care providers. And so we really want to make sure that we have an accurate list of all medication. That's really, really important for safe care. And the process of medication reconciliation involves checking to make sure that we have all of the right medications listed and the correct dosages and when they're supposed to be taken. And so sometimes that means that we need to connect with an area pharmacy or go back to the family doctor to clarify, but we want to make sure that we have good information because that's a very risky area for our patients. It's a challenge to do that work when some of our outpatient visits, our clinic visits, are really short. And so we have been focused in doing this in our highest risk areas first. And so we have fully implemented medication reconciliation in our early intervention in psychosis clinic, which is one of our clinics in the mental health program. And we're rolling that out to other clinics. But the message that we want every person in our community to have is bring your medication with you every single visit, including when you come to urgent care. So one of the things that I hear every day from nurses in our urgent care is it's really hard to triage and care for a patient safely when they say, I'm on a pill, it's purple, it's small, bigger than a vitamin C, smaller than a multivitamin. So even if nobody asks to see them, bring your medication every single time, because if there's ever a question, we can look at the bottle and see exactly what dosage you're on and which ones and when you take them. So that's a message really important for all of you to take home with you today. So I mentioned earlier our total joint replacement program. So I'll zip through this really quickly so I can turn it over to the next speaker. We are funded to complete about 170 joints per year, and that's unfortunately the way that the ministry classifies it. It's by number of joints per year. We do our surgeries on Mondays. Patients go home by the end of the day on Wednesday. We get them up and moving the same day. Very low infection rates, very high levels of satisfaction. Our patients want to get home to their own comfortable beds with their own PJs and with their own families as quickly as possible. And so that's a really great way to get people in and out quickly. And it has dramatically reduced wait times for this particular surgery across all of southeastern Ontario. And there's a process through the local health integration network where a hospital that is having a hard time meeting their target numbers can actually work with the local health integration network to move those volumes to another center that has capacity. So we've been able to take on a few more of these surgeries so that people in our region have access to as rapid care as possible. Ophthalmology is another program where we probably see most of our senior activity. We have over 70,000 visits a year in that program alone. We do all sorts of things there. And I've used the short form TX, which is short for treatment. So we do cornea transplants. We have macular degeneration program. Lots and lots of people coming in for injections regularly for that. We do about 2,700 cataract surgeries a year. We treat glaucoma, retinopathy, both diabetic retinopathy and those for premature babies. We have adult and pediatric specialists on site. We train about a third of the ophthalmologists in Ontario and about 1 in 12 in Canada, so it's a very large program. It's a group of very young, extraordinarily accomplished physicians. We have terrific nurses and other professionals in the program. And we're currently in the expansion stage. So we're about to expand into another part of level 6. If any of you have ever been to the eye clinic, you know it's really busy. And the rooms are called lanes in an ophthalmology area. And that's just a fancy term that we use to describe the room and the equipment in it. So we're going to be building 5 new exam lanes, a space for giving eye injections for treatment, and then also expanding our diagnostic area, and that's going to happen in the next short while. We're just at the blueprint stage. And we've also been trying to roll out some educational programs for people interested in learning more about eye health, so stay tuned for more information about that. And we recognize that vision loss is a major life change with people, so we're really giving some thought to how we can better support our patients who come in and receive news that they're losing their vision. And cardiac rehab, this is a program that serves people who have either had a heart attack or a heart problem or may be at very high risk. This is a really exciting program. The participants are registered in the program through a referral, so usually from a cardiac surgeon, but it could be from a family doctor. The minute that we get that letter saying you've been referred, we say to patients, start coming now to the education classes. You don't need to wait until you're actually in the exercise program. Come right away. And then we design a special exercise and therapy program for each individual person to improve their fitness level, get them back into heart-healthy shape. We have all sorts of programs around healthy eating, heart-healthy eating, and then we really try and make sure that we manage our participants' stress so that they're doing everything they can to improve the health of their heart. And it's about a 16-week program. Includes a very broad group of people as the team, lots of different kinds of professionals, and it's about a 4 to 6 week wait to get into the program, but as I said, as soon as a patient's referred, they can start coming to classes, so that's really good news. Finally, just one slide on accessibility, and that is that we're really trying to be mindful of the fact that when people come to a hospital, they sometimes need help and support, and that's actually a realistic expectation. When we go to the mall, we don't really think about the support we might need, but when we come to a hospital, we expect that we might need some assistance. So we have porters, volunteers, and security officers stationed at our main entrance to try and help get people in and out safely, direct traffic, get people wheelchairs. We've got a special washroom with a wheelchair lift, and that's actually Karen Sutherland's here. Thanks to Ronald McDonald Charities, a few years ago we were able to build a beautiful new washroom that has a wheelchair track that can assist older children and adults who need that specialized support for toileting. Our elevators are equipped both with braille numbers and with sound, and as I mentioned, with all of our eye patients, they can't often see the numbers when they're trying to get out of the building, especially if their pupils have been dilated. So having the voice that says second floor is really helpful. We are ordering all the time more wheelchairs for use so that people, when they come to the hospital, if they need to be able to have some support moving around, we've got that. We're starting to roll out some signage in different areas that just alerts family members that if they're with someone with dementia, to let the staff know so that we can make sure that we do a safe transfer of care. So when the patient is done with their visit, we will actually make sure that they come right back to their loved one and there's no one going missing. And we're looking at an option to boost our volunteer program to have some companions to support people who come for a visit and are alone and don't have someone with them. We're doing a number of other things related to senior-friendly activities and accessibility. So I will stop there since I think the clock is buzzing and turn it over to the next person. Thank you.
Thank you so much.